Welcome to Doctors of the Baobab. On this podcast, we go beyond the white coat to get to know the doctors that we admire and respect. Join us as we explore the stories behind the stethoscope, uncovering the humanity behind the medical expertise, whether it's navigating the complexities of patient care, overcoming personal obstacles, or advocating for change in healthcare systems. Each episode promises to inspire, to educate, and to uplift. So sit back, relax, and prepare to embark on a journey of self discovery with Doctors of the Baobab. And in today's episode, I am pleased to have as my guest Dr. Noluthando Nematshwarani, who is a luminary in the field of medicine, boasting over 2 decades of unparalleled expertise and fervent commitment to healthcare excellence. As the distinguished member of numerous committees in her organization, undeniably the largest healthcare funder in South Africa, she orchestrates visionary strategies that shape the landscape of modern healthcare. She has been at the helm of groundbreaking COVID-19 clinical response, and she also leads with unparalleled vision and determination. From crafting pioneering funding policies to orchestrating webinars featuring top-tier experts, she stands as a beacon of innovation in the fight against the pandemics. Driven by an unwavering belief in health as a fundamental human right, she tirelessly advocates for accessible, high-quality healthcare for all. She brings a passion for driving positive change and a dedication to healthier, happier communities, and she inspires others to join her on the journey toward a brighter, healthier future. Dr. Noluthando Nematshwarani, welcome to Doctors of the Baobab.
Thank you so much. Thank you so much for inviting me. Really excited.
And I'm so glad to have you as somebody that I've known for 30 years plus. So when I introduce you, it really sits very deep within me because I'm really speaking from observation of you, not only in your professional capacity, but also your personal capacity as a friend. And so everything that I've said, I know people say, oh, you really hype the doctors up. Yes, I do hype the doctors up, but I've witnessed over many, many years how true this introduction is about you. So I want to go back maybe to when we first met. I know we were much younger then at medical school. I know we don't look it. But let's start with your journey that got you there to the University of Natal. At that time, it was still the University of Natal Medical School. Your childhood. What happened? What events happened that brought you to the medical school?
Thank you so much, Dumi. I mean, I've known you for all those many years when I was still young and and still a teenager. So yes, I grew up in a small town in the former Transkei. So in South Africa, we had the homelands, Transkei, Ciskei, Venda, Bophuthatswana, and the like in Ciskei. So I think growing up in a small town in Umtata, and my mother, who was a nurse at the time, exposure to healthcare was through, the local healthcare public facilities and also our primary healthcare physicians who were the GPs in the town. So firstly, my mother, who was my role model and continues to be, this nurse was committed to the work that she was doing, and she would not only look after her patients in the facility where she was working, but also she looked after us. She took care of us. So, the healthcare we experienced it in the home environment with our mother. And I think, a few times when I have been sick, when I had been sick as a young girl, my mother would take me then to the local GPs. And I used to see how busy they were because they were not only servicing the small town which was the capital town of the former Transkei, But, people from the surrounding rural areas, they used to come to this small town to seek healthcare, and they would come to these GPs. I mean, it was like a few of them, but I mean, I can still remember the two prominent ones who used to be so busy. So I would go there whenever I was sick. And I mean, the queues were long, and you could see that there was a great need for healthcare. And these particular GPs were really carrying the load for the majority of the Transkei, including those rural areas. So I think I was inspired to say, you know what, there is a need for the services. And I'm looking at my mother who's in the healthcare field, and she's inspiring me to actually go into this field because I could see her passion. And I think in me, I've always wanted to make a difference in people's lives. And I thought this is the best, career and profession to actually, pursue. And that's why I chose medicine. When I was young, I mean, people used to say, maybe you must be a social worker. I didn't know what a social worker would do, but you know what? I understood what a doctor was doing, and I experienced the doctor. And the social worker, maybe it was a bit distant to me because I'd never seen a social worker doing the work that they were, trained to do. But a doctor was an immediate profession that I thought, okay, I've seen it, and I know there's a need for this, and I did my own research, and I understood where these doctors trained, and I did my applications, and fortunately I got accepted, and I joined the University of Natal Durban at that time at the medical school, which is where we met.
But I want to ask you, now that you are better informed about other professions, would you still make the same decisions? Would you consider social work now that you know more about other professions?
Without a doubt, I'd still be a doctor. I can't see myself doing anything else. And it's such a blessing, I must tell you, it's such a blessing to do something that you love. And, you get paid to do stuff that you love. And I think for me, it was really, I consider this, it was more than just following a career. It feels like it was a calling. So it feels like, I mean, I always speak to people and say, actually, my job is my ministry. And I feel that every day when I wake up and, perform my duties is really what God designed me to do.
Mm-hmm. And doctors, who consider their profession to be a calling or a ministry, are a very interesting group of people. And I've come across some literature that suggests that when doctors consider their profession to be a calling, their resilience and the ability to manage stress is a little bit better. What are your thoughts around that? In terms of you worked through COVID, which is probably one of the more recent stresses, but also through the HIV epidemic. Again, I'm exposing our age here, but how did that factor in? Yes, the two major epidemics of our lifetime. How did that understanding that this is a calling for me, this is my ministry, how did that carry you through those periods as a doctor?
I think, I mean, that research is really, it's spot on because, when you do something that you love, even if I always say to people, I just don't have enough hours in a day. But, I don't dread waking up and going to work. I can spend those long hours doing my job because it is something that I love. It's just that my body sometimes it's like, please now take it easy. But you really feel energized to do the work, and because that there's a greater good that's associated with what you do, it really is much easier to do. So also, when you do work that you are, it's almost like you're wiring where it's really that calling. It is something that is in you. It's much easier to perform those duties. It's effortless, if I can put it that way. And it's very fulfilling. You could do it without being paid because you just love doing it, and you excel because of that passion that is associated with it being something that you believe it is a calling for you. So yes, that's how, I think maybe you become more resilient. it's unlike when you are doing a job that you don't like. Then, I mean, we know the opposite effects of depression, anxiety, and, you know, poor mental well-being related to people who are doing jobs they're not really called to do, and it's just getting paid for it. Doesn't matter how much money you can get if it is not something that you are called to do. There's so much effort that goes with that.
Mm-hmm. And many guests that I've spoken to also speak about that as what drove them to finish medical school, because we both know it's not easy, irrespective of where people have studied. Medical school is not the easiest training. It's very grueling, it's high hours, it's very strenuous. And as you know, a lot of people drop out, just can't handle the pressure of medical school. Would you say that was what kept you going throughout medical school? Or were you also supported and had other sources that helped you to finish medical school, pumped and ready as
Yeah.
a doctor?
Oh, definitely. I think, I mean, there is I mean, I didn't know that I was gonna love medicine that much. I knew though that it was something that I wanted to do. But you know, when you get to varsity, and like you're saying, I mean, it's a heavy, hectic course to embark on without friends, you know, who have got the same values and who are equally principled and who also know why they are there. You know, I don't think you can do varsity by yourself. I tell my kids the same. I say you do need that support structure, you know, of like-minded people who are also just as energized by what they are there to do and who equally want to finish this degree and go and make a difference in the world. So I think that was one piece, and also just it's remembering when your where you're coming from. So I come from humble beginnings, and I was there, you know, doing this degree with other, you know, children from other different backgrounds. So I had to remind myself every once in a while that, you know what, there are people back at home who are relying on me to complete this degree and go back and make a difference. And the difference is not just, you know, serving a community, but it's also about uplifting your own family in the process. So I think for me, those were the things that really inspired me to want to finish my degree record time, and, you know, to stay focused and make sure that, you know, what I was there for, I complete and I go out there and do what I was supposed to do with the degree.
Mm-hmm. Mm-hmm. And one thing I do know about you is that you're not afraid of studying, because that once upon a time you were my study motivator, right? We were both doing our masters together, period, which is very intense. When we were at a different phase in our life too, where we had other commitments, and I do recall that you were definitely somebody that would motivate me through that period as well. Would it be accurate to say that you do love study? Because the MSc that we did together was not the only qualification that you had. So take me through your qualifications and why you love studying so much, if that is accurate.
I think it's just acquiring knowledge that excites me, you know, learning more. So I did my undergraduate degree in medicine, and then I thought, in fact, I thought have been a clinician, you know, seeing patients, you know, going the traditional clinical route. I thought I'd be a dermatologist. I tried to apply, but they never accepted me because there were such limited posts. So I thought, you know what, I enjoyed pharmacology, and, you know, I was already a GP, and I thought, you know what, pharmacology is something that it was a specialization that I felt would really improve, because I also went into private practice as a primary care clinician. So I thought it would improve how I script for my patients and all of that, and also just understanding exactly why we prescribe what we prescribe. So I went and I did pharmacology, masters in pharmacology. And I actually think what was exciting is that I actually joined an exciting department at the University of Pretoria, because they didn't teach pharmacology the way I was taught pharmacology as an undergraduate. You know, it was not learning about the drugs, it was understanding the disease process and how drugs influence the pathophysiology of a particular, condition, which was quite exciting for me because even when I was teaching, then I could teach with understanding that, if a patient presents with heart failure, this is the pathophysiology. And then by the time I bring in the drugs, you will understand exactly what the pathophysiology is and how drugs influence that. So I really enjoyed it. And now I ended up at the University of Pretoria lecturing, which is something that I never thought I would do, but I enjoyed that as well. So I think being in an academic setting really made me understand my passions and the things that drive me and the things that excite me. And I think my love for academia was really fueled at that point in time. And I wanted to do more. So I was like, okay, I've got pharmacology. What else can I do? I thought, okay, I could go into, this area of pharmacoepidemiology. And I thought, okay, what must I do then to get there now? Okay, I'm going to do epidemiology. That's when I did my master's, in biostatistics and epidemiology. It's because I wanted to almost join these two worlds of pharmacology and epidemiology, because if you understand the origins of diseases, and then you can almost bring in the treatment component and understand how the treatments actually influence that. It was really exciting for me. So yeah, I think I always say to people, I'm an academic at heart. And I just believe, I'll always be that academic at heart, which is why even the work that I do, even in the corporate setting, involves research, understanding, because you can't formulate funding policies without understanding what the guidelines say, and also understanding what the literature is, critically appraising literature that's published out there and synthesizing that and, using it in a meaningful way. So I think that's really who I am. And it's exciting to just learn more and understand more as engage with, the information that's out there.
Yeah, yeah. And I want to just go back to something that you mentioned about one of the desires that you had early on was to study dermatology, but that door was closed. Now, as someone who is coaching doctors, and even from my own experience, the doors do close. Doors are closed, and I want to get your approach to that. Where have doors been closed that you really wanted to open, and what happens when you find that your heart maybe is leading you in a certain direction, only to find that perhaps that opportunity doesn't exist? How do you approach that?
Yeah, and I mean, it also depends why you are knocking at that door, because we also knock at doors for different reasons. We knock at a door because we really believe this is the door for me. Okay? And when it doesn't open, or when it's shut, then that's where, you feel a bit upset and disappointed. And sometimes we knock at doors because we're trying to escape something else. So it's not necessarily because we think that's the right door for me, but it's almost like, while I'm still finding my door, can I just maybe get into this other one? And when it gets unopened for you, it can be disappointing still, because obviously you're trying to run away from something. And sometimes there are doors that, they're just there and you're not sure whether to knock or not knock, and they open for you and you don't know whether to walk in or not. So there's all of that. But I think, having been alive for the amount of time that I've been, I also understand that sometimes you can be grateful for closed doors, because there are certain things that you think this is for me, and you don't get it, and the alternative becomes the best alternative for you. The door that you land up, knocking, no, maybe not even a strong knock. It's like, okay, because I couldn't get there, let me just, but that becomes the best door for you. So I think when doors close, sometimes you must be grateful that they closed, because another door will open, and it may be the best door for you. But yes, if you still feel that, you've gone through different doors, but there's still something that's lingering inside of you that says, I'm still not satisfied. So you must definitely pursue that particular door, because maybe indeed that is the door for you. I must say, I've seen it with many other people in my life that, what you initially think you will do, you go and maybe the door is closed at the time, but the alternative door becomes the perfect door for you. So it's trusting that sometimes,
Yeah.
in
It's
the
about trusting yourself as well, right? And trusting and believing that indeed that is the right door. And I'm hearing from you also some courage that it will take to go through a door that you hadn't planned to go through.
But can I
Now
also
you
say something? Yeah, can I also say
sure.
something? The problem is that sometimes the doors that we choose may be, doors that are comfortable for us.
Hmm.
There's a sense of comfort that relates to the door that you're choosing. But then by closing that door, it actually challenges you. Because I mean, certain doors that you let, I mean, if you were to ask me at med school when we were there, the two of us, that are you going to be working in a corporate environment doing XYZ? I would have said, are you mad? You understand what I'm saying?
Hmm.
And then for whatever the reason, I couldn't do what I thought I would do, which was I'm gonna go follow the clinical route. But I am so grateful that I didn't, because what I'm doing now is much more fulfilling for me than maybe the door that I would have chosen for myself.
Yeah, yeah. Very, very profound and very important words. And I want to still stay on the analogy of the doors, because I know the corporate environment is reputed to be a little bit cutthroat, right? Uh, are there doors that you have had to kick down and regretted it, or doors that you've kicked down and not regretted it, where it is really worthwhile to say, listen, I had to push through this door. Come hello high water, I'm going through this door, and it worked out in the end. Do you have examples of that?
So I think my approach, when I look at the corporate environment, is that firstly, when you get in there, I mean, as a doctor, there was no prior exposure to the corporate setting, and I actually didn't know what to expect. And we usually doctors, we come in just wanting to do work, because our training says just go and save a life.
Naively so.
Naively so. And then you look around and you see everyone is carrying their ladder, you know, their invisible ladder. And everyone is like, this is my career path. So my approach has been very different. And, it's that approach that says, I'm here to work. I deliver good quality work, and the doors fall by themselves. I don't have to kick them, because the quality of the work will speak for you. And I think if people can, I know people, they always want to, like, I must be responsible for my career. I must. Sometimes if you push too hard, and sometimes you may be pushing too hard when it's too early for you to get into a specific door. But if you focus and commit yourself, your work definitely will speak for you.
So one has to know when to really push the door open, right? And I love what you're saying about the self-awareness, right? That also comes with that, so that you absolutely making the right decision at the right time with the right environment, and that comes with a lot of wisdom as well. Now, in your corporate work, no doubt you have to consider the burning issue of work-life balance, right? Whatever that is, I try not to get into the definition. Is it a thing? Is it not a thing? But one thing I do know about you, and have known about you for a very, very long time, is your commitment to your family, and the importance of your family to you. How are you keeping these balls in the air?
Yeah, it's tricky. There's no work-life balance. I think we've learned that there's a blend. you blend work and life and home life and family life. And it's about knowing that it's a give and take. You may sometimes, I always make an example. So there will be times when I need to go to my son's school, for example, for whatever. I must be able to take from work to be able to, but there will be, in fact, there are many times when I have to then take from family because I have to give back to work because we've got deadlines, we've got things that we have to do. I'm working at night to get my work done. So it's important though to make your family not feel that they are less important, because at the end of it all, they are your golf balls, they are the important ones, but I think because they know I've got a very supportive husband who really appreciates and understands, me and what makes me happy, and my work makes me happy somehow. So it's really accommodating me to be able to do the best that I can in my workspace while still being a mom and a wife to him and a mother to my children. I come home, I cook for them, I make sure that, the stuff that I have to do as a mother and what I have to do as a wife, I don't compromise on those. But I can still be a good, career woman. I can still deliver for my community, and I can still be involved in many other things outside my family. So I think it's having a supportive family that allows you to sometimes give a little bit more, but knowing that you will also take a little bit when it's required. And yeah.
Mm-hmm. And through that process now, your career and trying to figure all these things out, your academics, your professional life, your family life, what have you discovered about yourself that you weren't aware of perhaps from the time that you and I met at medical school, that you have learned about yourself and how that influenced your life choices?
Yeah, so I think the one thing that I've learned about myself is that I'm a teacher. I love teaching. I didn't know that about myself at the time. And yeah, I've learned that actually I'm also quite resilient, and I didn't know that about myself. And you have to be tested to actually say, okay, I've gone through all of that and I'm still standing. And you've mentioned COVID. COVID was a trying time. It was really hard. And, I've looked at some of the work that we did during COVID, and I asked myself, how did you do it? And when people ask me, how did you do it? I also say, I think, God just enabled me to be able to do it. And it was hard, but there was a lot that was required of us to actually deliver. Just putting together content and making sure that it's good quality content that's going to support people. Because remember, people needed a good source of information that is reliable and credible, and we needed to provide that. And with the webinars, to try and make sure that doctors had access to the relevant information at the right time from experts, from people who understood what was going on. So it was spending a lot of time, reading, putting together, also putting together benefits and all of that stuff. So that's where I actually realized that there is, I'm a very resilient person, but also just providing support to others. You realize during those times when suddenly people feel that they can trust you, that they can approach you for stuff, and now you have to carry others, and you still are able to go through that and not fall apart. So I think, yeah, having gone through, all these epidemics, thinking about the HIV time, when it was also a very trying time when we lost patients and we couldn't. But, through it all, I could teach. If I think about the rollout, now I'm taking you back to 2004, going out there, teaching doctors about the pharmacology of ARVs, when people didn't know, how we're going to treat this virus and how we're going to help patients. And I was there on the road doing this work. So I think you learn a lot about yourself as you start doing things and you realize, okay, I never thought I could do this. And you also realize how much fulfillment you get doing certain things.
In that description, I was hoping, but I also know how doctors are very humble, that you would mention that you also a leader, right? So I want to talk about that aspect of it, because I know myself, knowing you from a very young age, that is something that inherently, you have a gift for, in terms of how you motivate people. So talk to me about leadership. I know you didn't mention it because you're humble, but your roles have involved leadership. Your philosophy around leadership, particularly when it comes to doctors, and what they should know about leadership from your experience.
Maybe I didn't mention it because as a doctor, you have to lead. I mean, we lead teams, we lead clinical teams in hospitals. I mean, our role is leadership. So when I got into the corporate environment, I assumed a leadership role because that's what I'm used to, the way other people who were there. Yes, I learned from them, which is another very important piece, that even if you feel that you are so highly qualified, you can still learn from people who are junior to you or people who you consider less qualified than yourself. They can teach you a lot. And I think that's one important thing. So I always say you are a leader by virtue of, my qualification as a doctor and the profession that I'm in, because it is required of me. But, I always use the analogy that, leadership, you can lead in various spaces. And I challenge my team all the time. I'm like, you're a mother, you lead in your household. You may be in a community and you lead in your community. So it's understanding what leadership is and taking charge and making sure. Maybe it's because also I like to see things happen. They know me and my family. I like to see things happen. For things to happen, somebody must take the lead. Somebody must inspire people to actually want to go to a certain direction. So I think it is part of our training and who we are and our role that we play in the healthcare system. But also, I'm a mother. I lead in my family, and I also am a member. I lead in a church. I lead in many other aspects. But it's also maybe something that's in me. It's just wanting to see things happen, and you automatically just take that leadership role because you want to see things happen. There are some people who are lazy, though. They could be amazing leaders. When they see somebody taking the lead, they then sit back and step back. But I think we should all understand that there is some inherent leadership in us because we assume it in various aspects of our lives, and we could still bring it in the work environment to actually drive specific projects and specific programs in the workplace.
So a doctor may be watching you, and where you are currently might think that it's not easy for you being in a corporate environment given your demographic, right? And I want to talk about how you maintain your authenticity and authentic leadership. Now, if you've been in a leadership role, you know that, especially if you're a woman or if you're an African woman, there sometimes comes this burden, whether it's internal or external, that you may feel of representing a whole demographic, and you feel people are watching you for good reasons, for bad reasons, and you still have to walk in this authenticity. How do you approach that? How is it a burden for you at all?
Yeah, I try not to dwell too much on that aspect because it can actually, drain you and drag you down. That's the word. So I wanted to say I show up the way that I am with everything of me. There is no me that is, oh, this is me when I'm in the workplace. This is me when I'm with friends. I'm the same across. It's just that obviously the way I will present myself will be slightly different in a formal environment and setting versus in an informal environment and setting. But it's about honesty. I mean, I know in the workspace that some people will be scared to say certain truths because, they are worried it's almost like they will say it's career limiting and all of that stuff. But I always say, as long as when you speak the truth, it's coming from the right place. It's not about destroying, but it's about building. And as an African woman, it's important to also know that there are others who are looking up to you. So for me, it's more of a responsibility, that we carry, that says there are others who are looking up to you, and you need to represent them well, and you also become a voice for the voiceless. So when you are given an opportunity at that table, you need to use it well, and you need to know that you are representing more than just you. It's a community of other people who are like you, who would really want you when they are not there to represent them well.
Wonderful place to end. Dr. Noluthando Nematshwarani, thank you so much for the conversation. It's really been a pleasure talking to you. And that wraps up another insightful episode of Doctors of the Baobab. And I hope you found today's discussion both enlightening and empowering. But before we part ways, I want to extend a heartfelt invitation to our audience. If you're a doctor, you've been inspired by what you've heard today, you're ready to take action towards positive change in your life, you can consider working with me, your host, Dr. Nondumiso Makumba Stevenson, as your personal coach. You can email me to learn more about my coaching services and how we can embark on this transformative journey together. Don't forget to subscribe also to the podcast so that you never miss an episode filled with valuable insights and strategies for personal growth. So if you know someone who could benefit from our discussion, please also be sure to spread the word and encourage them to tune in. And let's stay connected beyond the podcast. Follow us on all our social media platforms on LinkedIn, Facebook, and Instagram. Join the conversation, share your thoughts, and also connect with like-minded individuals who are also on their journey to living their best lives. So thank you so much for tuning in today. Keep striving, keep growing, keep shining bright. Doctors of the Baobab, where medicine meets motivation.